I drank more water and started urinating frequently. Could it be diabetes? The short answer is possibly, but not necessarily. Increased thirst and frequent urination are recognized symptoms of diabetes, yet they can also occur for several other reasons. This video explains the connection, the other possibilities, the tests that provide an answer, and the warning signs that require urgent medical attention. First, notice the pattern. Drinking extra water naturally makes most people urinate more. That alone does not mean diabetes. The concern becomes stronger when thirst feels excessive or difficult to satisfy. Urination is much more frequent than usual. You wake repeatedly at night to use the bathroom, or the symptoms continue even when your drinking pattern returns to normal. Why can diabetes cause this? After food is digested, glucose enters the bloodstream and provides energy. Insulin helps glucose move from the blood into the body's cells. In diabetes, the body either does not produce enough insulin or cannot use it effectively. Glucose then builds up in the blood instead of entering cells normally. The kidneys continuously filter the blood. When blood glucose becomes too high, the kidneys may be unable to reabsorb all of it. Extra glucose passes into the urine and pulls water with it. This produces more urine. Losing extra fluid then makes the body thirsty, so the person drinks more. This thirst and urination cycle is called polydipsia and polyuria. Other diabetes symptoms may appear alongside thirst and urination. These include increased hunger, unexplained weight loss, unusual tiredness, blurred vision, slow healing wounds, recurrent skin, urinary or yeast infections, dry skin, and tingling or numbness in the hands or feet. Some people have only mild symptoms, and many people with type 2 diabetes have no obvious symptoms for years. Type 1 diabetes can develop quickly, often over weeks or months, and symptoms may become severe. Type 2 diabetes usually develops more gradually as the body becomes resistant to insulin or does not make enough. Gestational diabetes develops during pregnancy and usually causes no symptoms, which is why routine testing during pregnancy is important. Symptoms alone cannot determine the type. Frequent urination also has many non-diabetes causes. Drinking more water, caffeine, or alcohol can increase urine output. Diuretic medicines, sometimes called water tablets, are designed to increase urination. Pregnancy, anxiety, cold weather, and habits, such as drinking large amounts close to bedtime, may also change the pattern. Never stop prescribed medication without speaking with a qualified professional. Urinary tract infection is another possibility, especially when frequency comes with burning, urgency, lower abdominal pain, cloudy or strong-smelling urine, fever, or back pain. In men, prostate problems can affect urination. Kidney disease, overactive bladder, high blood calcium, and rarer hormone conditions may also cause thirst or urinary symptoms. A proper assessment looks at the full picture. Ask yourself a few useful questions. When did the symptoms begin? How much are you actually drinking? Are you producing large volumes of urine or passing only small amounts with urgency? Do you wake several times at night? Have you lost weight without trying? Are you unusually hungry, tired, or unable to see clearly? Have you started a new medicine? These details help a clinician choose the right tests. The only reliable way to know whether you have diabetes is appropriate blood testing. A fasting plasma glucose test measures glucose after at least 8 hours without food, except water. An A1C test estimates average blood glucose over roughly 3 months. A random plasma glucose test may be used when symptoms are present, and an oral glucose tolerance test measures the response to a glucose drink. For adults who are not pregnant, commonly used diagnostic thresholds include an A1C of 6.5% or higher, fasting plasma glucose of 126 milligrams per deciliter or higher, or a 2-hour oral glucose tolerance result of 200 or higher. A random plasma glucose of 200 or higher may support diagnosis when classic symptoms are present. A clinician usually confirms the result with another test unless the presentation is clear. Prediabetes means glucose levels are above normal but not yet in the diabetes range. Common ranges include an A1C of 5.7 to 6.4%, fasting glucose from 100 to 125, or a 2-hour tolerance result from 140 to 199. These numbers need professional interpretation, especially during pregnancy or when anemia or hemoglobin variants may affect A1C accuracy. A home glucose meter can provide useful information, but one reading does not diagnose diabetes. Results may be affected by timing, food, illness, technique, the meter and test strips. If you obtain an unexpectedly high result, record the number, the time and when you last ate, then contact a healthcare professional. Do not begin diabetes medicine or borrow another person's medicine on your own. Seek urgent care if thirst and frequent urination occur with vomiting, severe abdominal pain, deep or rapid breathing, fruity-smelling breath, marked drowsiness, confusion, severe weakness, or inability to keep fluids down. These may signal diabetic ketoacidosis, a medical emergency that can sometimes be the first recognized sign of diabetes, especially in type 1 diabetes. While arranging an assessment, drink water normally to prevent dehydration, but do not force extreme amounts. Avoid sugary drinks, which can worsen high blood glucose. Keep a simple record of drinks, bathroom visits, nighttime waking, and other symptoms for 2 or 3 days. Continue prescribed medicines unless a clinician advises otherwise, and take your medication list to the appointment. If testing confirms diabetes, do not panic. Diabetes can be managed. The plan may include nutrition changes, physical activity, medication, glucose monitoring, and regular checks of blood pressure, eyes, kidneys, nerves, and feet. The exact treatment depends on the type of diabetes, your results, other health conditions, and personal circumstances. Early diagnosis and consistent care reduce the risk of complications. If the tests do not show diabetes, persistent thirst or frequent urination still deserves attention. The clinician may check urine, kidney function, electrolytes, calcium, infection, pregnancy, or medication effects. The goal is not simply to rule out diabetes, it is to identify the actual cause and provide appropriate care. Quick quiz: true or false? Drinking more water and urinating more automatically means you have diabetes. The answer is false. Extra water alone can increase urination, and several conditions can cause similar symptoms. Second question: can a single home glucose reading confirm diabetes? No. Diagnosis should use appropriate laboratory testing interpreted by a qualified healthcare professional. Remember the key message: persistent excessive thirst and frequent urination can be warning signs of diabetes, especially when combined with weight loss, hunger, fatigue, or blurred vision. Do not guess and do not ignore them. Arrange a blood glucose assessment, know the emergency warning signs, and seek care promptly. This video is for general education and does not replace individual medical advice. Subscribe to Healthy Living Hub for clear, reliable health education.